Welcome back to ARC Las Vegas on this Thursday morning. And COVID was in everyone's mind 4 years ago. Well, now it's back. We're seeing an uptick in cases here in the United States, including Nevada.
And our commander-in-chief sort of came down with the virus right here in our city. And, well, it's sparked off a lot of changes here. We want to know what officials with our Southern Nevada, health district, they've confirmed some of the new variants that have already been detected in local wastewater. We're bringing in the experts here this morning to talk more about it. This is Dr. Mark Kahn. He's the dean of UNLV School of Medicine. Dr. Kahn, thank you. Thanks for being here this morning. How bad is it right now?
Well, we're starting, as we get into summer months, people get out of the heat and tend to collect in air-conditioned spaces. So that's perfect to transmit viruses and respiratory viruses like COVID. So it's not surprising that there's an uptick. The good news is that the more recent variants, the flirt variants and others, tend to give most immunocompetent people, pretty mild symptoms that last a couple days, and then most people get better relatively quickly. So that's the good news. But the current variants are very transmissible.
Our current Attorney General here in the state of Nevada, Aaron Ford, he tested positive for COVID after the President of the United States was here. Aaron, was in close contact with him, and because of that, he got tested. Didn't even know that he had COVID, so that's how mild his symptoms were. But this is still deadly, or can be, right? In 2020, 2021, COVID was very deadly. Not as much anymore, but still of some concern, right?
Folks that are older or immunocompromised always have to be careful with respiratory infections like COVID. Fortunately, for most of us, it looks like the current variants produce a relatively minor disease or asymptomatic disease, as we're seeing. And the natural history of a virus, because viruses want to multiply, is that if a virus kills the host, it can't multiply. So over time, viruses tend to mutate to be much less lethal, but much more transmissible. And I think that's what we're seeing now here in Las Vegas and the rest of the country.
Dr. Kahn, what's the biggest thing you're telling your students or your faculty, your peers, really anyone who comes to you with any sort of medical advice? What are you telling them about best suggestions right now? Are we still here in 2024 doing the same preventative practices that we were doing 2 or 3 years ago?
The answer is no, and that's because we've learned more about the virus, but also the strains that we're seeing now are much less virulent and much less lethal. So what I tell people is, if you're sick, stay home, isolate yourself. If you're immunocompromised, it's always a good idea to stay out of crowded spaces. And that's probably the best advice.
Dr. Kahn, we only have like 5-10 seconds, so I need a quick answer on this. I know they try to reformulate the vaccine every year to try to match the disease that's circulating. Would you still recommend people get a vaccine shot this fall?
You bet. And that's because the vaccines take into account the newer variants. And we know that vaccinated people, if they get infected, have a much milder course. So yes, get vaccinated.
He's Dr. Mark Kahn, the dean of UNLV School of Medicine. Thanks for being with us.